Welcome to Soft Bites Podcast. Your life, your dentistry. We talk about ways to have more fun and meaning in one of the coolest and most rewarding professions in medicine. Conversations on how to bring awareness, create a healthy workplace, and provide emotional insights to make dentistry a fulfilling activity while making space for one's wonder, creativity, and freedom. Here are your hosts, Manuela and George Andre.
Hello, we are back. Yes. Welcome to the Soft Bites podcast. Hello, Andrea. How are you?
I'm fine. Long time no see with the vacations and everything, but we are back on
Yes, yes,
work.
yes, yes. And today we're going to talk about something that I think it's really important, and it's something that I don't see it very often talked in the dentistry world, but I think it's something that happens and it's very common. And I think it's going to be an important talk. We're going to talk about how
Hmm.
to keep seeing patients as human beings.
Yeah,
So, of course, this is common sense. Patients are human beings and we are dealing with human beings. But I think that in dentistry, at a certain moment, and because there's a lot of routine and we already talked about that, a lot of repetition, there's a lot of stress also, there's a lot of things
stress.
sometimes
Mhm.
that you cannot really control, and sometimes it's like a switch that you have and you are
Yeah,
not aware of it sometimes, and then you start seeing patients in another way. You start to objectify
yeah,
patients. I don't know if you start
yeah.
seeing them as numbers. What do you think? Or do you just
I
how do you
was,
start objectifying the
yeah.
patients? Numbers?
I think it's, yeah. I think it's numbers. I think it's objects. And I was when you were talking, I was just remembering. You enter what you know when you go to a hairdresser, and you can clearly see they are in autopilot. They just want to get you done with, and because there's a lot, because they've been through a hard day or whatever, and they enter into that autopilot mode. And you also see that in very, I would say, old doctors. Sometimes you see that. I mean, they are just fed up with the profession. They almost don't talk. They just want to get it. They just want to get it done. They just want to get it over with. And I don't know if it's numbers or if it is objects, but I think that if you are a dentist that has practiced for a considerable amount of time, I'm sure that you know exactly what we are talking about. I mean, you enter into that mode that you just want to get the appointment done with. You want to get rid of the patient as soon as possible to come to the next one. And I think that there's a lot of causes for that. There's a lot of reasons why that happens, and the environment you just told us, it is dentistry is stressful, it's repetitive, you see a lot of people, and you enter the hairdresser mode. That's what I like
Mhm.
to call it.
It's
And
very
it's
it's
I
very
think it happened
tiring
to.
also. It's very
Yeah.
tiring.
Yes,
It's
exactly, it's
exhausting.
exhausting physically. Yeah.
Mm-hmm, mm-hmm,
Yeah.
mm-hmm, mm-hmm, mm-hmm.
Yeah, and also
Yeah.
because one of the things that happens, and I think that I've talked about this before, which is dentists, we are treating patients that are awakened, right? I mean, if you are doing surgery, the patient is not awakened, and you don't actually need to be so much concerned about being nice to the patient. You understand? Because the patient is just knocked out, right? But in dentistry, the patient is awake, and you have to be minimally polite. You have sometimes to do some small talk and stuff like that. And sometimes you're just not in the mood for that. Even only the fact, I think that the hairdressers, they go through exactly the same thing. Even when you have to do small talk all day long, you get fed up with small talk, right? You just can't do it anymore. I'm just going to say, I'm just going to ask the same stupid old questions, and you just get fed up with that. Um, but yeah, you were asking me something that I think that I got lost.
Hmm. No, no, I didn't ask you anything. I mean, in the beginning, I was asking you if it's not like human beings, how do we dentists start seeing patients? And you already answered like objects, numbers. We don't know, but we start to objectify them. But it's my and now I'm going to make you a question. Do you think that when this happens, that the dentist has the conscience that this is happening, or it's something also that goes in the automatic pilot mode, and that you are not aware that you are starting to objectify your patients, and that also that leads to other sources of stress, because that will add stress to your day if you start objectifying your patients, and we can talk about that later, because due to that you will start to have lack of motivation, for
Yeah.
example. But do you think this is something that you are not aware that that's starting to when it starts to happen?
I think that you are aware and you are not aware. So I think that you become aware that you're tired and you don't have the same focus on the patient. You don't have the same tolerance with the patient. I think that we all understand that, and I think that we all come to a point where we become aware. Look, there's I know that I'm not very tolerant with this patient, or I know that I'm not very tolerant with the patients, with the last three patients of the day. I think that in that sense we are aware of that. I think yes. But I think it also develops in the long term with a different thing, which is, sometimes I wonder, how was I like to some patients 15 years ago? And how am I like to them now? By this, I mean, am I as nice as I was there? And probably not. And of course, some of that has to do with the fact that you don't want to be extra nice to patients, right? And that's a mistake, because then you become a prisoner of your practice. And we talked about that. It's difficult to delegate. That's one thing. But the other thing is that I will divide this in two things. One thing is, you are worn out at the end of the day, right? And I think that you are usually aware of that. I mean, you don't have that much tolerance or patience to like small talk. That sometimes you need to do some small talk, and you need to be. I mean, if you have a difficult appointment before, you have to get yourself together for the next one, because you just don't want to show to the next patient with a has face, right? You have to get yourself together, right? Um, and at the end of the day, I think it's more difficult to do that. And I think that we are mostly aware of that. Now, the other thing is that what happens in the long term. And I think that as years go by, especially when you work for 10 years, 15 years, 20 years, I don't think that you have the same. I don't think you are never as nice to patients as you used to. And in one sense, that is good. In one sense, that is good. Uh, but in when you're talking about the long term situation, I think that most of the times we are not aware of that. That we have lost, and this is, I think, where it gets interesting. And you actually mentioned this when we were discussing about this subject. I think you lose a little bit of your human nature when you are talking to patients, and you sometimes forget the why. Why are you actually doing this? And, why are you actually in healthcare? Why do you actually like this profession? Because I mean, you may not like dentistry eventually, but I'm sure there are things that you like, and sometimes in the long term you tend to forget that. You tend to forget why you actually like dentistry. And one of the biggest reasons that I think that dentists like dentistry is the human connection, up to a certain point, right? I mean, we all enjoy the fact that we can. Dentistry has a lot of negative stuff, but one of the most positive things is the human connection, right? you get to actually make very almost intimate connections with some of the patients. You become friends with some patients. You understand their problems. You understand sometimes that you are one of the only persons that can actually be nice to them for many days, right? And you feel that obligation, and if and it's very cool, right? It's very cool because you can actually feel that you can make not only a technical difference, not only a clinical difference, but also an emotional difference in the lives of some patients. And I think that in the long term, this is the thing that gets affected. I think that we start to disconnect ourselves of what makes life special, which is human connection, right? It's at the end of the day, life is about human connection. And I think that we get run in the I think that we get run in the daily stress, and day by day, month by month, year by year, we tend to forget this. And I think it is and this, I don't think that we are that much aware of that. And I think that's one of the things that the podcast can actually, at least for the small audience that we have, which is actually not that small, but the for the audience that we have, I think one of the cool things about doing this podcast is actually to remind people of remembering the basic stuff in their life, and that dentistry can actually be a very a very fulfilling profession. But yeah, to make a long answer short, I think we have two sides here. One thing is the wear that you suffer throughout the day. So at the end of the day, you don't have the same tolerance and the same presence and the same will to be nice to patients or to be enchanting to patients. That's one thing. And here, I think that you are aware of that. Most of us, we are aware that at the end of the day, we are not the same, and we are aware of what's going on. But I don't think that
Hmm. Hmm.
the changes in the long term, I don't think that we are aware of that. Most of us, I think that we get lost in the years. Yeah.
Hmm. Hmm. It's very interesting what you said, because I have just the only thing that I wrote here, the notes that I did about this um, about today's subject, is that it's not about to keep seeing patients as human beings. It's to try to keep how to the secret is how to keep the human connection. So that's, and you just said that. So it's all about that, how to um, keep maintaining the human connection that led you in the first place to dentistry. Because this is something that I work a lot with dentists. I mean, of our age or older, because and of course, in the younger generations, it's not so visible, because they don't have as many years of work, of course. But when you have 20 years of dentistry, it's very easy to objectify patients. So it's like patients are turned into your yeah, and not only a number, they are your main source of stress. So when I ask a dentist with 20 years of experience, what's your main causes of stress, I get answers as late patients expectations, patients this, patients that. So, and the to really work on this, on the sparkle, of the human connection, on the why, like you were saying, to really, because I think it all starts, of course, with you, and also the way that you start your day. So we work in the intention, the intention of having fun during the day, the intention of listening to the patients in an active way, the intention of not treating patients as a number, but really asking the person, how are you, how you been doing since the last time that I saw you. Not to try to be nice just for nice, like you were saying, but yeah, that's it. So, to connect with the human side of the person, because everyone deserves respect, and everyone deserves to be treated as respect. and not just as one more, like you said, when you arrive to a place, either as a dentist appointment or a hairdresser, like you mentioned, or whatever, but you make an appointment, so you expect at least for that half an hour or 45 minutes or 1 hour, that you have the person's attention. And a lot of the dentist work is technical, so a lot of that time it will be spent in a way that the other person cannot communicate with you. So they are conscious, like you said, so it's a technical, and sometimes a very it's a surgery, it's a surgical procedure, but people are conscious, but they are not able to talk. So part of the time it's spent that way. But there are the other part that it's not only yeah, it's respect. So the person made time to be there with you, chose you as the professional. So I think there's a lot of there that it's the answer to a lot of yeah, even the motivation, to know that you are making the life of that person better, to contribute for that. And I also think that if you value your patient as a person, they will automatically value as a professional and as their dentist. So and going back to what I've just mentioned, I think that you are a person also that works with intentions. Don't you think that to because this is something that it has to be intentional. I think this is something that you have to keep
Yes.
on, that you have to keep
Yes.
remembering yourself.
Yes.
Don't you think
Yeah.
that it makes all the difference to have that awareness, and to, okay,
Yeah.
this is the way that I want to
Decide.
spend my yeah, to spend my day. I want to
Yeah.
see continue to see patients as human beings. And from
Yeah.
that moment, what are the small actions that you can take? Because we already talked about this, and we talked about this a lot in the podcast. Sometimes it's just simple things, it's just simple actions, simple changes that make all the difference. And let's talk about some of those practical actions, because you can have that intention in the morning and you say, okay, today I will bring the human connection to my appointments. I will see my patients as human being. What this means in a practical way? What can a professional, a dentist, do to see patients as human beings and not as objects or numbers, or just stress, or just triggers of stress? That happens a lot.
Yeah. That's a good question. Actually, I was writing some notes here, which has exactly have to do what you are asking. Um, I was just, I think that the goal, and then we can talk about some strategies and tactics. So the goal, I think is, um, I think that you really have to make a decision in your life to be. I don't know if happy is the right word, but to um, be to enjoy the process, no matter what is going on. So
The good and
the
the
thing
bad,
is,
right?
the good and the bad, yeah,
Yeah.
we talked a lot about the 80%, right? And I think that
Mhm.
this is a rule that's really helped me a lot and really made a shift in my life, which is there will be, when you wake up until you go to bed, there will be people annoying you. Sometimes you are annoying people as well. There will be things that go wrong. There will be veneers that break when you bond. There will be implants that fail. There will be patients that are late. There will be patients that don't pay on time. There will be patients that are hassles. This thing is going to happen, and you have no control over that. What can you do? I mean, you can learn how to dance in those things, and learning how to dance has a lot to do with all the systems and protocols that we keep telling about, making sure that you have like systems just to avoid that patients can eventually cross some boundaries. Make sure that you have a very good welcome pack. Make sure that basically the patient understands the practice policies in terms of payments, in terms of lateness, in terms of teamwork. They understand. Basically, you have to set, I would like to work in this way, and I have to make it clear for my patients because that will avoid a lot of problems. And I think that needs to be placed aside, and that will solve in itself 80% of the problems. But even with an amazing system, things will go wrong, you know. And I think that you have to make a conscious decision to learn to dance with those things because I think that the beauty of life actually happens when you start to understand when you have a hidden smile inside yourself, even though things are not going your way. And I think, and if you keep that hidden smile inside yourself, even when things don't go your way, you'll always have a place to go to refresh yourself and to be nice to the next lady or to be nice to the next gentleman that you are about to treat. So I think that the number one thing is to set. Actually, the number one thing is of course systems in the practical thing, and
Hmm. Hmm.
that needs to be there.
In
But then
order.
in terms
Hmm.
of emotional and mindset, I think that uh, I think that you should set yourself macro life goals. I have mine. I've talked about that. I have my professional goals, my spiritual goals, my financial goals, my relationship goals. I have those things written down. And I think this is a very good exercise because it is something that is very dynamic and it's something that helps you reflect on exactly the kind of person that you want to be. Because I think that when you start to think about these things, about setting life goals, about setting whatever you want to do, you realize that even when you set financial goals, you set financial goals because you want to have more. At the end of the day, you want to have more peace, you want to have more time, you want to be able to do the things that you want. And at the end I think what you actually want is you want to have more peace, right? Of course that you also have to have some fun, but you basically you don't want to be unhappy, you don't want to suffer. So, and I think that once you set these goals, you realize that you can actually try to go directly to the end result. You don't need the money, you don't need the cars, you can throughout the day go directly to that result. And I think that developing this mindset will really help you a lot. And this is basically the same thing of saying of, I mean, there's a lot of cliches that they are cliches because they are completely right, which is like learning to dance in the rain. It's not about making the rain stop, it's just learning to dance on the rain. The 80-20 principle, being happy when 80% of things are good, which is already very good. Just try to accept that things will never be as you want them to be exactly. Um, and once you realize that you can actually have have a mindset that understands that there are lots of things that are out of your control, and no matter what, and I think this is the key, no matter what goes out of your control, you will always have that inner smile inside you. I think that makes a huge difference because and of course, this is very easy to say. I mean, if you have like an health problem, if you are depressed, if you have like a serious disease, I mean, it's very difficult to reach this because that's always on top of your mind. But if things are fairly okay, if things are reasonably okay in your life, I mean, there's no way that you cannot feel this inner smile inside you. I mean, you are alive. I mean, I'm sure that most of us that have people around us that like you, that love us. We have, of course, we may not have perfect practices, but I'm sure there are positive things about many of the nurses, of the patients, of the staff. So you can always grab yourself to that. And I think this is, I don't know, I don't know if this is something that if you are not used to, if you are not been exposed to on a regular basis, I don't know if you can get that from one day to the other. But I think that really starting to write down exactly what you want in your life and starting to read about, I don't know, starting to read about the goals that you want and I think that will certainly lead you to a place where you realize that the end result of your goals is actually peace and avoid suffering. And you can go immediately to that throughout your day, right? So I think that this is really a very, very important mindset. Because if you don't have that mindset, I mean, if you live concerned that you haven't achieved your financial goals, you are missing the whole point of life. That's my point of view. And if you have something that you can hold yourself to throughout the day, I think it's much easier to do the connection to then to get ready for the next patient with an open heart, let's say. And this seems a little bit cheesy, but actually, it's something that you have to train yourself. I think that throughout life we are not, and you were asking that if this needs to be if this needs to be intentional, absolutely needs to be intentional. I mean, you have to practice these things, and you have to write down exactly the kind of person that you want to be. This is my perspective, or at least think about it, and there comes meditation. Because if you develop this consistently, if you consistently develop the intention, or the awareness that you can actually that small moments can actually be a source of happiness for you, I think it makes everything much easier. Everything is much easier. So I would say that there are macro strategies, and the macro strategies to, I would say, meditate. I would say journaling. I would say set goals, and actually know exactly what you want in your life. Because when you set goals, something very important happens, is which is uh, what is the kind of person that I want to be, right? And you realize, okay, so if I want to be this person, so I want to get the money for what? I want to get the time for what? Uh, so if I am this person, the end goal is actually peace and avoid suffering. So why can't I just access that right now? Or one of the other goals, which I think is very important, which is um, being a positive energy for people around you. Just try to make other people's lives somehow easier in that day. And of course, this is like a universal goal. And actually, I think that actually this is the one of the most common goals of when you set some goals, which is, so I want to write a book, or I want to do a course, or I want to make a piece of art. Why? Because I want to help someone else, right? So at the end of the day, the goals are always going to be the same. It's going to be to have peace, to avoid suffering, and to help others, to be a positive contribution. Okay, so I want to have money to have a positive contribution. I want to have money to have time. I want to have time to have peace. But actually, if you think about it, they are much closer. All these three things, they are much closer to you. They are much more achievable, even in like small parts of the day that you can actually think of. So if you spend too much time thinking about how you can achieve them, you are actually stressing yourself. So on the macro level, that's it. I think that's setting goals and thinking about exactly what is the kind of energy that you want to attract in the world, or the energy that you want to transmit in the world. I think on the macro level, this is really important. So setting goals and thinking about what kind of person you actually want to be. Uh, and don't think only about the house or the money or the vacation, but because actually the money and the house and the vacation are just the means to peace. That's what I would say, or also that other people can eventually um, respect us or enjoy us, or whatever. But actually, what we really want, I think, it's peace and avoid suffering, and and help others. So that's on a macro level. On the micro level, so on a daily basis, so what can you do in order to don't objectify patients that much? I think that sleep and energy are very important. I mean, if you have to get with the basics. I mean, if you're in rest, you're not going to be in a good mood. Um, if you and if you, for example, do some sort of exercise or meditate, I think that you'll start the day in a good mood. Now, okay, so you're working. Let me give you an example of what happened to me last week. I have this patient that he owes me a lot of money, not a lot of money, but it's just he owes me quite some decent amount of money. Nothing major, but But then he only then whenever he books an appointment, he misses the appointment, and then he calls when he has an emergency because the provisional has fell off and he didn't want to complete the treatment. Okay, immediate reaction. I'm pissed off with this guy, right? This guy doesn't deserve me. This guy is an idiot. I'm going to start. I'm going to start to talk jokes about these guys with the nurses. We are starting to be, the whole team is starting to be cynic with the guy. That's really really easy to want to happen, and it happens to all of us. We start just like making jokes about some patients because they are like this, or because they are very difficult patients to treat, or because they always arrive late, or because they don't pay things on time, or because they are just a pain in the ass. So the thing is that I think there's a rule that I give to myself, and sometimes I always forget, is that when you are reactive, you always lose the game. If you are overreactive, you are always losing the game with the patient. Then you have to keep things in a professional way. So I always try to think about this way. Okay, so this guy is owning the practice money. Why? Because we facilitated on that, because the system at that time did not ask for money in advance. So is it his fault? Actually, it's not his fault. So I have to. So how responsible am I for this that is happening? Okay, so let's tackle this. Let's note this down, and let's just incorporate the system to avoid this. Okay, so this patient is missing appointment. So what can I do for that? Okay, I can eventually have a system that charges patients after the third missed appointment, and you just have to follow that. This patient is, I mean, there's something about it that makes him funny, and that makes him that sometimes that we, I mean, that there's something about the patient that eventually can be a joke reason within the staff. um, it's very easy that that happens, but I think that, and this happened to me this week, and when I came to sit down with the patient, I clearly remember having this thought that came to my mind and said, okay, yes, we made some jokes about him, but now you're sitting him in front of him, and it's just a human with another human, isn't it? It's just, so how, what's the best that I can treat this guy, knowing that we have already tackled the situation of the payments, because he was called to the attention. Look, you have this and this pending. You have to make us uh, you have to propose us like a plan to pay this, or a schedule for payments, and that was sorted out. And we gave him another plan to just to solve the emergency, because he didn't have the money to do the complete thing. So the the logistical part, the physical part was taken off. I mean, he was aware of the money that he owned. We wrote that down on the computer. He promised to be paying X amount by month. Okay, we give him a provisional treatment plan of the things that you should be doing just to address the emergency, because it was a front tooth. Okay, all the logistical part is set. Now, I just need to be a human again to this guy. I don't need to be cynic. I don't need to be ironic. I don't need to be, um, yeah, I don't need to be ironic with the guy. I don't need to keep this. I don't. I have no need whatsoever that their energy or their behavior energy affects me. I think that if I set a goal that I want to be a positive influence for people around me, this is exactly what I am going to do. But I don't think that you can do that if you don't address the issues that have been provoking that stress in the practice. So the physical world needs to be taken care of, so that on an emotional level you feel more relaxed and you can actually be the person that you want to be. Because if the guy gets inside the treatment room and all of the other things were not settled before, I mean, if the nurses did not handle the situations before, then we have an issue again, which is then I will be facing a person, and inside myself I know, look, this guy is not paying on time, this guy is missing the appointments, this guy is doing this and that, and there's no way that I'm going to be sweet with the guy, or that I'm going to be myself. Why? Because there's this burden that I'm carrying in myself, that sooner or later is going to show off when I talk to him. So this is why, in a micro level, I think that the physical world needs to be dealt with, so that I can be myself, genuinely and warmly, to this person when they are in front of me. So I would say that from a macro perspective, I think you have to set goals and understand the kind of person that you want to be, and understand that you have to make a commitment to be married, to try to be happy no matter what, right? Because things will go wrong. And on a micro level, just try to manage the physical things that you can manage, and after that, just try to let go the things that are bothering you about the patient, and you can eventually be yourself. But I also mentioned something, which is, you have to be fresh, you have to be rested, and you have to be fresh. There's no way that you can do this if you do 20 patients a day. It's just
Mhm.
impossible to do that. I mean,
You,
you have to see what is your limit. Yeah.
yeah, you mentioned a lot of things there, and it's very, very, very interesting. And I also think that if you are basically, you talked about self awareness and
Yeah.
emotional awareness. You even mentioned that you had the awareness of your thoughts in order to realize what was going on and what the situation was, and that you could not let yourself be ruled by that thoughts that and emotions, and that's very interesting. And but don't forget that that requires already a certain level of training. It's like you said, this has to be trained. But what you mentioned is self-awareness and emotional awareness, in order not to get reactive, just like you said. So you are responding to the situation, and you are giving your best to another human being. Because what usually happens if you don't have that kind of awareness that you just mentioned is, and even if we are not even talking about that extreme situation that you were talking, you gave a very practical example of a situation that involve money and a considerable amount of debt of that person. But if we are just talking about the usual patients getting late, and or even you being late on your appointments, which also happens, or patients having unreasonable expectations, or making demands that are not reasonable, that kind of daily things that happen in a dental clinic. For example, in the end of the day, you will be aware just of your tiredness and how exhausted you are. You will not have the ability to be aware that due to that tiredness, due to that exhaustion, you just want to get that done. And yes, you are not connecting to the other person as a human being, because you just want to get things get things done. But you are aware of your tiredness. But the thing and the link here that I found so interesting that you said, and I add this to my notes, is taking responsibility. So the thing is that you will blame the tiredness and the exhaustion, but you don't take responsibility for most of the times. You don't take responsibility for what's happening. About what you said about that, all that macro managing that you have to do, and that includes, of course, taking good care of yourself, because it's a highly demanding profession, and you have to be on the top of your game, and that demands you taking very good care of you, and not only physical but in a mental way. You working on your mindset, you to be able to develop that inner smile that you are talking about. You have to what you are talking about is that you have to train your mind. You have to be aware of your thoughts. You have to develop meditation practice in order for you. And for example, that's one of the things that I teach on my mindfulness courses. One of the actions that you can do is to take time between patients. It doesn't have to be a lot, but you can just have like 5 minutes or two, 3, 5 minutes, whatever it is between patients, when you just do some deep breathing, when you can really do the reset. So you let go of the patient before, so you can start fresh from and you can bring not only the physical part of the breath, and you really get into disconnecting the automatic pilot into
Yeah,
relaxation
I find that so
mode.
interesting. Yeah,
Yeah, but also you can bring the intention. You can say, okay, there's a new person
yeah,
coming from that door. I'm going to
yeah.
give that person my full attention. So you do the reset, you disconnect the autopilot, and you start fresh with the other
Yes,
person. So this is an easy a
yeah,
trick or
yeah,
procedure or whatever
yeah.
for you
I,
for
I'm
you
gonna
to
I'm
to
gonna
do.
tell you something.
Yeah.
Yeah, I'm gonna tell you something
hmm
that you're gonna love, which is in the lines that what you were saying. Yeah, that you have to, I mean, stop between patients and just take, I mean, do whatever it takes so that you can ground yourself again and just ground yourself to the person that you are. And in order to do that, you have to have like a drama free practice, right? And we talked about a lot about that, the importance
You
of
should.
having systems and having culture and stuff like that. But I want to tell you something that you're going to love. You know what is the thing that I would like to, I mean, if I further expand my practice, I have 4 dental units now. We have a kitchen slash lounge where there is also some computers, but there's also always work involved in there. We have a studio. The next thing, if I expand my practice further, what I would do in my practice is to have a gym there, a gym slash lounge where it is a place where there's no work allowed or no work subjects or no work talk allowed.
Make it also
Because I think that
phone free.
meditation place,
Yeah, and
phone free,
phone
that would be
free,
nice.
phone
Yeah.
free, because there's this study. I will send it to you, and I'll put it in the notes, that they compare this 5 minutes that I was talking about of pause between meetings. When you do it, when you do the exercise of focusing on your breathing, or stretching, or grounding yourself, or if you spend time just scrolling on your phone, or whatever it is that you think that you are resting, but you are actually not, and it's completely different results.
Having a gym or having a place in the practice where people can chill out. I think the gym because it's
Where
it's
they can
it's one of
can
the
exercise, they can stretch, they
yeah
can meditate.
yeah yeah
Yeah, make it gadget
yeah
free. Yeah. hmm
yeah. I think it's
yeah, I
very I think
think.
it's very
Yeah.
interesting because
Yes, yes.
if you are always in a working in a dental treatment environment, you always have this stress going on. It seems like you never disconnect. Well, if you go to a different place, I mean, if you just go there, I mean, you can eventually meditate there if you want to, or you can just exercise, just go for just do some rowing or just do some push-ups or whatever. I think it's very interesting, and also look at the amount of time that actually your staff can save if they go to the gym during the lunch break, or if they go to the gym before they start to work, or if they go to the gym after work, right? So I think it's really, really an interesting idea, and I hope that I can get rich enough to open a gym. I'm joking. I'm joking. No, but I hope that
I think
that
it's a nice plan. I
that it
think
can
it's a
happen.
I think
Yeah,
it's a very, very, very nice plan.
yeah.
And
But what you were
and
saying is it's really important. You have to stop and connect to yourself, and of
hmm
course this might be easy if you have like 20 years of meditation, of 20 years of getting yourself into of thinking about this stuff or journaling about this stuff, or just really trying to be the best person that you can be and doing, I mean, that if you really think about these things and you learn with your mistakes, I think it can really place you in a completely different level. And I understand that if you are not used to being mindful and being aware of who exactly you are and who exactly you want to be, and try and meditate on that on a regular basis, then I think it's more difficult. And this is why I think this is a long-term journey, and it's much easier for me now than it was 5 or 10 or 15 or 20 years ago. Of course, yes, yeah,
Mhm. Let me see if you let me just say, because we are almost ending in the end of our time, but I'm going to say three practical measures. See if you agree and
okay,
what you add to this. So first, it
okay,
all starts with you and the way that you start your day. Have the intention, even if it's just something like saying to yourself, I'm not treating teeth, I'm taking care of human beings. So remind yourself
yeah.
of that. Establish that intention for yourself in the morning when you enter the clinic.
Yeah, I would add, sorry, Manuel,
Yeah, yeah.
I would add before of that to set life goals,
Mm-hmm,
because
mm-hmm,
setting
mm-hmm,
life goals and thinking regularly about your life's goals will eventually lead you to understanding that we are all wanting the same thing, which is being loved, giving love, having peace, and contribute. That's all that we
mm-hmm,
want. We want to have peace, we want to contribute, we want to love, and we want to be loved, right? Everything that we wish for in terms of time, vacations, money, cars, clothes, looks, whatever, is just a means to get this. And I think that
mm-hmm,
if you understand this, you can immediately realize that actually this is quite accessible from me at any time of the day when I decide to go there. If I decide to be like this, if I
mm-hmm,
decide
mm-hmm,
to be loving, I will get this achievement, right? If I
mm-hmm,
decide that I'm worth of being loved, I will get this achievement. If I stay in peace, if I calm my mind down, I will be in peace. And also, if I treat others well, if I do a good job, I'll be contributing. I mean, you don't need to get the Ferrari or the Porsche or the apartment front side, beach side. You don't need to get to be able to get this one. You can get these ones if you decide that you want to get them now. So that's what I think that life goal is actually the first thing.
and the second has also to do with what you just said. It has to do for
Okay.
you to put in practice the kind of person that you want to be, the kind of dentist that you want to be. And if you want to keep on discovering that human connection with patients, you also have to take responsibility so on your actions. So, and you also have to have
Yes.
time. So make sure that what you are doing, as in what you want to do as a dentist and what you want to achieve with the dentist, that you are matching that in your agenda. Because sometimes, and I hear this a lot, oh yes,
Yes.
I would love to do that, but I don't have time, I have to have appointments every half an hour. Yeah, but you have to take responsibility and you have to make conscious choices. Make
Yeah.
sure you have time to listen to your
Yeah.
patients, to talk
Yeah.
to them. Make sure that you are, yeah, indeed taking care of human beings and not just treating teeth, and that needs time. And also make sure that you have time, just like we said, to take just 2 3 minutes, 5 minutes, just to take some deep breaths, to do that reset,
Ground
to
yourself.
really
Yeah.
ground yourself, to connect with yourself, to disconnect the automatic pilot. This will disconnect the automatic pilot immediately.
And to remember
Also,
why you are doing this.
yes, that's it. To connect with your intention, that intention that you set in the beginning of the days. And but this, of course, requires time. But you will gain so much more. You will gain the motivation. You will gain the joy. You will gain you will rediscover again your why and the reason why you are doing dentistry. And the third, and this has to do with what we've been talking about. uh, don't talk bad or don't comment patients. Do not do that. It can be something big, like the situation that you just described, or it can be just something small, that the
Yeah.
patients are
It's
late
never
or they
good.
are rude or whatever. It's never good. And if
Yeah.
your staff
Feels
listens to
that.
you doing that, they will do the same and they will feel authorized to do
Yes.
the same and they will think that's
Yes.
a normal thing. And that
Yes.
when you have a clinic that is supposed to serve people, commenting those people that they are supposed to serve, it's never good. So it's really, it's puts you in a situation that it it takes the patient out of the equation in the dental clinic, and the patient has to be part of the equation. So when you comment patients in a not good way, then you are really putting a distance, and you are taking the patient and the value of the patient from your work environment. So don't do that. Don't, when you see or when you listen to someone doing that, you can even call in a positive way, but just if I think that if you put these three really very practical actions in practice, you will really feel a difference. Set an intention. See what really kind of dentist you want to be. Discover really your goals as a person, as a dentist. And you, sometimes it's they are not very
Yeah.
different, you know, because
Yeah.
dentistry is a big part of
Absolutely.
our life.
Yeah.
So they are
Yeah.
really even if they are different, they are connected. For sure, they will be connected. Then take responsibility. Set the intention of just not treating teeth, but taking care of human beings.
Yes.
Connect with that
Yeah.
reason why you become dentist
Yeah.
in the
Yeah.
first place. Take responsibility with
Yeah.
practical actions. See if you need more time of appointment. See how you can connect, bring that human connection. Take breaks between
Yeah.
patients. Be self-aware. A lot of that self-awareness that you just described, you know, to have the self-awareness and the emotional awareness of
Yeah.
understanding that if you bring that bias, if you bring that judgment into an appointment, that can really have an impact on the way that you treat a person. So that's why, of
Yeah.
course, if you are biased, you can commit treatment errors or diagnostic errors also.
Yeah.
So self-awareness really has a very positive impact on your daily clinical practice,
Yeah.
and
I was
really
sorry,
see
sorry,
it.
sorry,
Yeah.
sorry to interrupt,
Hmm.
Manuela, because I think
Please.
that the last point that you said, it's really important that you said that
Hmm.
do not mock patients or talk or make jokes
Yeah.
about patients, because that can really go viral in staff and they can feel authorized to do that. And I think this is very common, and I have to admit that I do it myself as well. Sometimes not in a very
We
negative
all
way,
do
but
it.
yeah,
We all do
yeah,
it. It's impossible not to do it. We are not.
yeah,
It's not about being super perfect here. That does not
yeah,
exist. Go for the 80-20 rule, just like you said.
exactly, yeah.
But
But
be
one thing,
aware
one
of what
one
comes out of your mouth.
yeah, and one thing that I like to add to that, and this is why I was missing this podcast because I just took some notes for the next meeting, which is set this as a culture rule
Yeah.
in your team, and make sure that you talk about that. Of course, that you always lead by example. This is if you are a certain type of person, your team will become that certain type of person when they are in the work environment. But I think it's really important that you, during the regular meetings that are really important, as we talked about, just drop once in a while, say, look, actually our goal is to treat people with respect and with humanity, and to respect all their differences, and treat them like human beings that they deserve, and provide a place of genuine and truthful human connection. I think this is really one of the great values, one of the principles that you can eventually base your practice on. We talked about that this is important to be written like operational principles and stuff like that, and values and cultural and the culture of your practice. So I think this should be a central one. Just make sure that your practice can also be a source of genuine and truthful human connection with other beings, that they can feel safe there. They can feel that they are talking with people that will be truthful and will be genuinely caring with them. It's really important.
Yes. Okay. Thank you. I don't know if you want to add
That was a good one. I was
something
missing
else.
you. I
Yes,
was
me
missing you. It's
too.
always good to
Thank
talk
you.
to you.
Yes, and I think this
It's
is so
always good to talk
so.
to you.
I think this is so important because I really think that this is one of the secrets for you to continue to enjoy dentistry for many many years. If you can
Yeah,
not forget how to keep the human connection and to really have this
yeah,
intention, because I think in the beginning when we
yeah.
start we all have, well, that's what we want, right? We want to treat people and we want to
Yes.
connect, but then I mean,
Yeah,
and we know there's a lot of things that contributed for this to happen, but this is one of the secrets to continue to enjoy dentistry and not to just be ruled by the tiredness and the exhaustion of the profession. So yes, I think it's a good one, and I think it's good for us to talk about this. Thank you so much, Andrea. Thank you so much for
thank
your
you.
for your wisdom, because I think it's really was you're really wise.
That's a good
I
one.
love you. I know that you always laugh when I give you a compliment, but okay, it's true.
Wisdom, that's the
Like,
ultimate compliment. Yeah, but
yeah,
but
it's
but thank you
true.
for that.
Yeah.
Thank you for that.
And for everyone listening, go to softbites.online. We have our conscious leadership course,
We have,
and
yeah.
all the information is there. And if you have any comment, whatever, just drop us a message or a comment. We always love to hear and from you guys. Thank you so much. Thank you, Andre.
Thank you, Manuela. See you next time.
See
Bye
you
bye.
next time. Bye bye, everyone. Bye.